We've talked about the importance of vitamin D, the high prevalence of vitamin D deficiency in the US, the proof that vitamin D is important to health, and some of the reasons why it's so important. If your vitamin D level turns out to be low, and this is something you can get checked by your doctor, what's the next step? Let's look. As we've said, vitamin D synthesis requires sunlight exposure on your skin to become active. And there are many reasons why sunlight exposure has decreased. Mostly people are doing it consciously to avoid skin cancer, but also because people are living and working in more urban environments and are more likely to be working and spending time indoors rather than outdoors. I don't recommend putting yourself at increased risk of skin cancer from UV radiation by excessive exposure to sunlight. I do recommend 30 minutes per day outside during the day to get some sunlight, but not getting burned by the sun. But this is often not adequate to restore normal vitamin D levels. The most effective way of achieving adequate vitamin D levels is with supplementation using the active form, which doesn't require sunlight on your skin. You can determine how much vitamin D3 you'll need on a daily basis by your level of vitamin D. It takes about 1,000 units of daily supplementation to increase levels by 10 units. So if your level is between 20 and 30, it needs to increase by a maximum of 10. So 1,000 IU or international units would suffice. If it's between 15 and 20, then likely 2,000 IU will be necessary to increase it 20 nanograms per ml. If your vitamin D level is 15 or less, it's likely you'll need high-dose vitamin D, usually 50,000 units weekly for 12 weeks before transitioning to a daily supplement. And if this is the case, I recommend you speak with your healthcare provider about getting high-dose vitamin D3 supplementation. You may have recognized that this is the first recommendation I've given where I'm only telling you to take a pill. All the other measures in health score are better achieved with lifestyle changes and avoiding medication. This is the one exception. With vitamin D3 supplementation, the benefits outweigh the risks, and there's no really good alternative to taking the supplement, which you can get over the counter.